Hello guys and welcome to a new episode by Pilotology. Today we're going to cover BasicMed for the second time.
Hello everyone, welcome to a new episode of Pilotology where we cover BasicMed for the first time.
I'm saying it for the second time because I actually have released a video about it before, but in November 2024 the FAA has made several changes to BasicMed. So today we're going to cover BasicMed in details, and also we're going to go over the changes made to BasicMed. So first let's start by what is BasicMed. BasicMed allow certain pilots to fly without an FAA medical certificate as long as they meet certain requirements. And before we dive into the details of BasicMed, let's first discuss what BasicMed is not.
BasicMed is not a third-class medical certificate reform. It's not a way to hide a medical condition that would interfere with flying duties or compromise safety. And definitely, it's not created by the FAA.
BasicMed is not a third-class certificate reform. When BasicMed first came out, a lot of people refer to it as the third-class certificate reform. No, BasicMed does not affect third-class certificate in any way. Third-class certificate remains the same, untouched, not affected by BasicMed. Matter of fact, BasicMed wasn't even made by the FAA. BasicMed was made by the Congress in a legislation law in 2016. So BasicMed and third-class medical certificate are two separate things. Second, BasicMed is not a way to hide a medical condition that otherwise would disqualify you from getting a regular medical certificate. You cannot use BasicMed to skip the regular medical certificate process. Matter of fact, in order to qualify to get BasicMed, you need to show the ability that you're able to pass a normal medical certificate exam. And we're going to talk a little bit more in details about this requirement later on. So just understand 2 points. BasicMed is not a replacement for third-class certificate, and it's not a way to hide a medical condition that would disqualify you from a normal medical certificate. So you're going to ask me, what is the purpose of BasicMed then? Well, mainly accessibility and convenience. In places where aviation is very common, like Florida or Arizona or wherever, it's very easy for you to get a medical certificate. All what you have to do is drive an hour or maximum of an hour to an AME, pay $100 and get your medical done in an hour, okay? But think in places where general aviation is not that common, where they don't have an easy access to AMEs, where they have to drive maybe 5 or 6 hours to reach the nearest AME, but also AME will charge them a lot of money because there's not many of them in that area. So that's the main purpose of BasicMed. The FAA or the Congress has said, well, if you're only flying for fun and you're not really making money out of flying, compensation or higher, we will allow you to fly with your driver's license as long as you pass a checkup with a local licensed physician and you meet certain requirements, which we're gonna discuss later in this video. So the main purpose of BasicMed was to allow you to only go to a local certified licensed physician and fly with your US valid driver's license. And now let's talk about the 4 requirements you need to meet to be eligible to get your BasicMed. First one, you need a valid US driver's license. Second one, you need to do a physical checkup, like I mentioned at the beginning of the video, with a state licensed physician every 48 calendar month. Third, you need to finish an online course every 24 calendar month. And the fourth condition is that you have held an FAA medical certificate, first, second, or third class after July 14 of 2006. Let's start with the first requirement, which is the US valid driver's license. And as I mentioned here, US valid driver's license. We're not saying a state photo ID. No, your passport wouldn't work. Your, I don't know, green card wouldn't work. What we look in here is a valid US driver's license. This means if it expires or revoked or whatever, the driver's license, your BasicMed does not work anymore. It has to be with a valid US driver's license. And you need to carry the US valid driver's license in the flight as well, along with the other requirements like your pilot license, your state photo ID, and your medical certificate, which is in this case BasicMed. Also, with the state photo ID requirement, you're able to just carry your driver's license for both requirements, for the BasicMed and also to kind of meet the requirement for the state photo ID. But for the BasicMed, again, it's a valid US driver's license. The second requirement, which is the physical exam every 48 calendar month, you need to print out the CMEC, which stands for the Comprehensive Medical Examination Checklist, and take it to a state licensed physician, which is gonna follow the directions in that checklist, and they will sign it, and you should be good to go regarding this requirement. So you're gonna ask, I go to my chiropractor back home, would that chiropractor be considered a state licensed physician? The answer is I don't know. Depends on the state. Each state has different standards on what they approve as a state licensed physician. So you should ask for their certification or ask them to know if they are state licensed physician or not. If they are state licensed physician, then you're good to go. And of course, if you have any questions, you can always call the FAA Medical Division or ask an AME. The third requirement is the online course. You have to finish it every 24 calendar month. It can be done on EOPA or Mayo Clinic. And the purpose of this course is just to educate you a little bit about different medical conditions, what are you experiencing, when should you ground yourself and not fly, etc. And the fourth one is having an FAA medical certificate after July 14 of 2006. And this is bring us to the first point that I made, where I said the BasicMed purpose is not to get around a medical condition that otherwise would disqualify you from getting an FAA medical. The FAA has asked you, in order to qualify for BasicMed, you need to show them the ability that you were able to get an FAA medical certificate after July 14 of 2006. It's okay if that medical normally expired. That's fine. If it expired in like 2010 and now you're in 2022 trying to get a BasicMed, you're good to go. But that medical that you got after 2006 could not have been revoked, suspended, or denied. This means if you got your medical, let's say in 2008, and it was revoked from you in 2009 because you developed certain medical conditions that revokes that medical, now you do not qualify to apply for BasicMed. And again, because BasicMed was not meant to be a way to get around the requirements for a normal medical. In order to qualify for BasicMed, let's say now in 2025, you're trying to get a medical. In order to qualify for BasicMed, again, you need to go grab a normal FAA medical certificate and then apply for BasicMed, and you'll be able to. What if you don't qualify for an FAA medical certificate? You need to go get an FAA special issuance or SODA, and then you're able to apply for BasicMed. Now, only the medical could not have been revoked, suspended, or denied, but also your most recent application. Let's say you got a medical in 2008 and it expired and it's fine, and in 2019 you applied for another FAA medical application and then you did not pass the physical exam, it got denied, then you do not qualify for BasicMed. But only if that application was completed and denied. So you submitted the application on MedExpress and you went to the AME and then you got denied, then you do not qualify for BasicMed. But if you only submitted the application and you never went to the AME, this means the AME never pulled your application or imported it to the system. That's not completed and denied. So you're fine because you never went to the AME. That's not considered a denial on your medical record. Now we're done with the requirements. Let's talk about the privileges. What does BasicMed allows me to do? Well, BasicMed is very similar in its privileges to a third-class certificate. It allows you to fly with like student pilot or private pilot privileges. It allows you to fly for fun. It allows you to become a CFI. Even now with the new regulations that came out in 2024, it allows you to become a DPE, an examiner. It also with the new regulation, it allows you to become a required flight crew member, like safety pilot. And a very good question you would ask right here, how come I can become a CFI with BasicMed, even though I'm not supposed to get compensated? It's going to be the same question as how come with a third class medical certificate I'm able to get compensated as a CFI even though I'm not supposed to? And the answer here is going to be like your private pilot privileges. For example, as a private pilot, you can get compensated as a salesman, right? If you have more than 200 out, yeah. So how come are you able to get compensated even though you're a private pilot? Well, because the FAA has seen that when you get compensated as a salesman, you're not really getting compensated for your pilot skills. You're getting compensated as a bonus from selling an aircraft. So essentially, you're getting compensated for your salesman skills. Same with a CFI. The FAA has determined that a CFI is not getting paid for their flying skills. They are getting paid for their teaching skills. So they allowed it under third class medical certificate and BasicMed. Now, the last part, let's talk about the limitations. First limitation is flights has to be in the US. Remember at the beginning of the video, I told you it's the Congress that did BasicMed. So essentially, BasicMed is not recognized internationally. So you cannot fly with BasicMed in Europe. A good question you're gonna ask me right here as well. Well, can I fly in Puerto Rico? Is Puerto Rico considered the US? I'll tell you, yes, you're able to fly with BasicMed in Puerto Rico. Because if you look at FAR 1.1, the definitions, and according to the FAA, you'll see the definition of the United States is the states, Puerto Rico, any territorial water or possession. So FAA consider Puerto Rico is a part of the definition of the US. So you're able to fly with BasicMed in Puerto Rico or any territories or anywhere considered to be the US. The other limitations we have here is obviously, like we mentioned before, you cannot fly for compensation or hire. The airplane cannot be authorized for takeoff weight more than 12,500. This means do not tell me, oh, well, my airplane is certified for 20,000, but I'll just load it for 10,000. No, the airplane itself could not be authorized to take more than 12,500 pounds takeoff weight. Same with the occupants. The aircraft cannot be authorized to take more than 7 occupants. So no more than 7 occupants, obviously 6 passengers max, because at least you have 1 pilot in there. Less than 18,000 feet on the altitude and no more than 250 knots on the airspeed. And this is it. We covered everything you need to know about BasicMed. Please don't forget to like and subscribe to the channel. Also, please comment below any ideas or topics you want me to cover. I will try my best to cover all your comments. And safe flying.